COVID-19. We lived through it. Millions died. The world shut down. Economies collapsed. Hospitals overflowed. Supply chains broke. We said we'd never let it happen again. We said we'd be prepared next time. But here's the question. Is the world actually ready for another pandemic? Or did we learn nothing? Welcome to Survival Theorem, where we analyze real threats with brutal honesty. Today we're examining whether humanity is prepared for the next pandemic. Because there will be a next one. Epidemiologists guarantee it. The question isn't if, it's when. And when it comes, will we survive? Let's find out. Let's start with the uncomfortable truth. Pandemics are inevitable. They're not rare events. They're regular occurrences throughout human history. The Black Death killed a third of Europe. The 1918 Spanish flu killed 50 million people. Smallpox killed 300 million in the 20th century alone. HIV has killed 40 million since the 1980s. COVID-19 killed at least 7 million officially, probably far more. These aren't anomalies. They're the pattern. Pandemics happen every few decades or every century, sometimes multiple in one lifetime. We're not living in unusual times. We're living in normal times. And normal times include periodic disease outbreaks that kill millions. Why are pandemics inevitable? Because the conditions that create them are permanent. 7 billion people, soon to be 8 or 9. Increased population density in cities. International air travel connecting every corner of the globe within 24 hours. Humans encroaching on wildlife habitats and encountering novel pathogens. Factory farming creating perfect breeding grounds for zoonotic diseases. Climate change shifting disease vectors into new territories. We've created the perfect conditions for pandemics, and we're not changing those conditions, so pandemics will keep happening. The question is whether we're ready for them. Let's examine what we learned from COVID-19 and whether we've actually improved our preparedness. Lesson 1. Early detection and response matters. COVID-19 spread globally before most countries even acknowledged there was a problem. China delayed reporting. The WHO was slow to declare an emergency. Countries waited to close borders. By the time lockdowns happened, the virus was everywhere. Have we fixed this? Partially. Some countries improved surveillance systems. The WHO created new rapid response protocols. But the fundamental problem remains. Countries prioritize politics and economics over health. They delay reporting outbreaks to avoid panic or economic damage. They resist border closures because of trade impacts. We saw this with monkeypox in 2022. Delayed response, inadequate containment. It spread because we didn't act fast enough. If the next pandemic is more contagious or more lethal than COVID, we'll make the same mistakes. Lesson 2. Healthcare systems are fragile. COVID overwhelmed hospitals globally. ICUs filled. Ventilators ran out. Healthcare workers died from exhaustion and infection. Elective surgeries were canceled. Non-COVID patients died because hospitals couldn't treat them. Have we fixed this? No. Healthcare systems in most countries are still understaffed and underfunded. We didn't add hospital capacity. We didn't train more doctors and nurses. In fact, many healthcare workers quit after COVID due to burnout. We're less prepared now than we were in 2020. If another pandemic hits with similar or worse severity, hospitals collapse again. And this time, we have even fewer healthcare workers to respond. Lesson 3. Supply chains are vulnerable. Remember the shortages? Toilet paper, masks, hand sanitizer, ventilators, PPE, medications. Everything ran out because supply chains are optimized for efficiency, not resilience. Just-in-time delivery means no excess inventory. When demand spikes, there's nothing in reserve. Have we fixed this? Minimally. Some countries stockpiled PPE, but supply chains are still globally interconnected and fragile. Most countries still rely on a few manufacturers in China and India for medications and medical supplies. If those countries shut down or hoard supplies during a pandemic, everyone else is screwed. We haven't restructured supply chains. We haven't diversified manufacturing. We're still vulnerable to the exact same shortages. Lesson 4. Misinformation spreads faster than disease. COVID showed us that social media amplifies conspiracy theories, false cures, and anti-vaccine propaganda. People died because they believed misinformation over science. Governments struggled to counter false narratives. Have we fixed this? No. Social media platforms made minor changes, but misinformation still spreads rapidly. Trust in institutions, governments, and science has decreased since COVID, not increased. The next pandemic will face even more resistance because people are skeptical and divided. We're worse at combating misinformation now than we were before COVID. Lesson 5. Global cooperation is difficult. COVID required international coordination, vaccine distribution, data sharing, border policies. But countries prioritized themselves. Wealthy nations hoarded vaccines. Poor nations were left behind. Information was withheld. Blame was assigned instead of cooperation. Have we fixed this? No. If anything, geopolitical tensions have increased. US-China relations are worse. Russia is isolated. Nationalism is rising. The next pandemic will see even less cooperation and more competition for resources. So across every major lesson from COVID, we've made minimal progress or actively gotten worse. We're not ready. Now let's talk about what the next pandemic might look like and why it could be worse than COVID. COVID-19 had a mortality rate around 1 to 2%, depending on healthcare access and variants. That's significant, but not catastrophic on the scale of historical pandemics. The 1918 flu had a 2 to 3% mortality rate, but killed far more because of global population and lack of medical technology. What if the next pandemic has a 5 or 10% mortality rate? What if it's airborne like COVID but as lethal as MERS, which has a 35% mortality rate? What if it combines the contagiousness of measles with the lethality of Ebola? These aren't impossible. Viruses mutate. Genetic recombination happens. Gain-of-function research in labs creates more dangerous pathogens. A lab leak or intentional bioweapon release could unleash something engineered to be devastating. If the next pandemic is significantly more lethal than COVID, our inadequate preparations become catastrophic. Hospitals don't just overflow, they cease functioning. Healthcare workers die in large numbers. Fear keeps people from working. Supply chains don't just strain, they break completely. Governments don't just struggle, they collapse. Let's walk through what a severe pandemic might look like. Month 1. A new virus emerges. It's respiratory, highly contagious, and has a 10% mortality rate. Initial cases are in a major city. Local authorities delay reporting to avoid panic and economic impact. By the time it's reported internationally, it's already spreading. Air travel carries it to dozens of countries within weeks. Governments hesitate to close borders because of economic concerns. By the end of month 1, it's on every continent. Month 2. The virus spreads exponentially. Hospitals start filling. The mortality rate becomes apparent. Panic sets in. Governments implement lockdowns, but compliance is lower than during COVID because people are exhausted and skeptical after the previous pandemic. Healthcare systems begin collapsing. Not just overwhelmed. Collapsing. Doctors and nurses are dying. Others quit out of fear. Hospitals close sections or entire facilities. People die at home because they can't get care. Supply chains break. Food distribution slows. Panic buying creates shortages. Prices spike. People start hoarding. Month 3. Death toll is in the millions globally. Some countries maintain order. Others descend into chaos. Riots over food and medicine. Governments declare martial law. Military enforces quarantines. Borders close completely, but it's too late. International cooperation breaks down. Countries accuse each other of causing the outbreak. Vaccine development is slow because of lack of cooperation and resources. Each country tries to develop its own vaccine instead of coordinating. Month 6. Hundreds of millions infected. Tens of millions dead. Economies in freefall. Unemployment skyrockets. Businesses fail. Currency devalues in some countries. Governments print money, causing inflation. People can't afford food even if it's available. Some regions establish harsh quarantine zones. Others give up on containment and focus on survival. Societies fracture into those who comply with rules and those who resist. Month 12. A vaccine finally becomes available, but production and distribution are bottlenecked. Wealthy countries vaccinate their populations first. Poor countries are left behind. The virus continues spreading in unvaccinated regions, mutating, potentially creating variants that evade the vaccine. Global death toll, 100 to 200 million or more depending on the mortality rate and response effectiveness. Economic damage, trillions of dollars. Political instability, multiple governments overthrown or collapsed. Social trust, shattered. This isn't fiction. This is what happens when a moderately severe pandemic hits an unprepared world. And we are unprepared. So what would actually prepare us? Let's talk about what we should be doing, but aren't. 1. Global Early Warning System. We need real-time disease surveillance in every country. Wastewater monitoring. Wildlife disease tracking. Hospital admission patterns. AI analyzing data to detect outbreaks early. And critically, we need countries to report outbreaks immediately, without fear of economic or political repercussions. 2. Surge capacity in healthcare. Every country needs reserve capacity. Extra ICU beds, stockpiles of ventilators and medical equipment, healthcare workers who can be mobilized quickly. We can't operate hospitals at 95% capacity during normal times and expect them to handle surges. 3. Distributed medical manufacturing. We can't rely on a few countries for all our medications and supplies. Every region needs capability to produce vaccines, medications, PPE, and equipment. Redundancy costs money, but it saves lives during crises. 4. Investment in vaccine and treatment development. mRNA vaccine technology proved effective for COVID. We need to develop similar platforms for other potential pandemic diseases. Have vaccines ready to adapt quickly. Invest in broad-spectrum antivirals that work against multiple virus families. 5. Public health infrastructure and communication. Rebuild trust in public health institutions. Combat misinformation effectively. Educate populations about disease prevention. Make public health a priority, not an afterthought. 6. International Pandemic Treaty with teeth. Countries need to agree to share information immediately, cooperate on vaccine development and distribution, and pool resources during outbreaks, with enforcement mechanisms, not just voluntary agreements. Are we doing any of this adequately? No. Some initiatives exist, but funding is inadequate and political will is weak. We're not prioritizing pandemic preparedness because people want to move on from COVID and not think about the next one. So here's the brutal answer to the question. Is the world ready for another pandemic? No, absolutely not. We're marginally better prepared than we were before COVID in some specific areas like vaccine technology. But overall, we're not ready. Healthcare systems are weaker. Supply chains are still fragile. Misinformation is worse. Political divisions are deeper. International cooperation is worse. If a pandemic hits that's significantly more severe than COVID, we're in serious trouble. Not extinction-level trouble, but civilization-threatening trouble. Governments could collapse, economies could fail, millions or hundreds of millions could die. And if it's a relatively mild pandemic like COVID again, we'll probably muddle through with similar outcomes. Millions dead, economic damage, political chaos, but not complete collapse. The threshold between we survive and civilization fails depends on the pandemic's severity and how quickly we respond. A 20% mortality rate with high contagiousness? That's civilization threatening. A 5% mortality rate? Catastrophic but survivable. Under 2%? We'll manage, barely. So how do you prepare personally when you can't rely on governments or institutions? 1. Build personal stockpiles. 3 to 6 months of food, water, and medicine. You can't rely on supply chains during a pandemic. 2. Develop skills. First aid. Food preservation. Basic medical knowledge. You might not have access to healthcare. 3. Build local community networks. You'll need mutual support. Isolated individuals struggle. Communities survive. 4. Have a pandemic plan. Where will you shelter? How will you get food? What's your communication plan with family? Don't wait for the pandemic to figure this out. 5. Stay informed. Monitor disease outbreaks globally. When you see something emerging, you act before governments tell you to. Early action saves lives. 6. Mental and physical preparedness. Another pandemic is psychologically devastating. Start building resilience now. Physical fitness matters when healthcare isn't available. So is the world ready for another pandemic? No, but you can be. And when the next one comes, and it will, being personally prepared might make the difference between surviving and becoming a statistic. That's the survival theorem on pandemic preparedness. The world isn't ready. Governments aren't ready. But you can be. Prepare now. Because the next pandemic is coming, and it might be worse than the last one. Stay alive. Subscribe for more reality-based threat analysis. Next time, we're examining how climate change creates pandemic conditions and what diseases are most likely to emerge. We're also continuing survival strategy breakdowns. Stay sharp, stay prepared, and remember, the next pandemic isn't a possibility. It's inevitable. Be ready, stay alive.